Phil, just look up.
There you go. I love it. Who else has a good word of wisdom today? Anybody?
You got me in quick.
Oh, we don't have music.
It's something with all the people popping in. It keeps talking. Let's see. Who else do we have on today? What are we up to now?
Are you still taking words of wisdom?
Please. Oh my gosh, let's hear it. Who? Okay, let's hear it.
Let's hear it.
Well, this is Ria, and my word of wisdom is you have to decide whether you are gonna let your emotions be determined by your circumstances for yourself.
I'm sorry, my dear. I couldn't hear you. There was an echo.
I
Is that echo me?
Yep. And me.
Clarice, is that echo me? I'm gonna leave and come right back.
Good afternoon, everyone. While we wait on our Madam Chair to hop back on the line, if you would be so kind to sign in on the Google form. There's one for the general continuum of care, and then there's one for voting members. So if you can sign into the Google form so that we can take proper roll call. There, Clarice put the links in the chat. If you can sign in on the Google Drive while we wait on our chair to get back on the line.
I'm back. Can you hear me okay?
Yes, we can. Thank you. It's much better too.
I do not know what happened. Thank you. Let's see here. Are we ready to get this meeting started? Okay. Good afternoon, everybody. Believe it or not, you are in the month of July. You are in the new fiscal year for those of you who operate your programs and budgets in a fiscal year. And I don't know about you guys, but I'm super excited about what the new fiscal year holds. And I just want to say that every challenge that we face is an opportunity. So, we just need to remind ourselves of that. And what I wanted to do was jump right into the meeting. So let's go ahead and move to the next slide, Ms. Clarice. Okay, so Rashawn already talked about the chat and the different roll calls. So especially for those of you that are voting members, you do want to make sure that you complete the roster because we do have agenda items that we need to take action on. And something that I'm always super duper excited about is new members. We want our table to be as big and long as possible, to have as many people at the table as possible. You can see that we have a whole host of new members. So I'd like to mention them. And if any of you are in the house,
Karen, you went on mute.
Yes.
I don't know why it automatically muted me. Thanks, Greg. Okay, so I'm going to list the names of the new members. If you are here, let us know. We have Caring Rose Human Services, Families
Right
First
here.
Housing. Oh, great, welcome. Families First Housing and Social Services, House of Royale, Vineyard Second Chance, Robert Gonzalez from RUHS Public Health, Guadalupe Martinez from Housing is a housing provider, community. How do we say that?
You got it. It's Community Jive. My name is Victor Candela.
Thank you. Thank you. Adriana, an advocate, HC2 Strategies Inland Path, SCQ Solutions LLC, and Anchor of Hope Homes. Anybody else here from those new members? Let's give them all a hand and welcome them. And just remember, you can become a voting member by attending 3 consecutive meetings. Your voice, your wisdom is important. So you do want to do that if you can when it comes to taking action on items. But if you decide to just remain as a member, we welcome that too. So welcome everybody. Let's go ahead and move to the next agenda item. At this time, the Continuum of Care will entertain comments from the public. Comments from the public can take up to 3 minutes. Clarice, did we receive any written public comments for the record?
Not from my end, no, we didn't.
Okay. And to our members in the Continuum of Care, if we did, we would just point you to them in the Google Drive. Are there any members from the public that wish to make a public comment? Raise your hand. And for the county team, thank you for watching out for me. I don't know what's going on with Teams, but if I miss something, please shout out like Greg did. So I appreciate that. Anybody from the public that would like to make a comment? Going once, going twice. Hearing none, we'll go ahead and move on to the next agenda item. Okay, agenda item 3, Continuum of Care Chair updates. I wanted to again thank you all so much for your support and confidence to allow me to continue to serve you as the chair of the Continuum of Care. I'm honored to work with the county team to do what we need to do to support you and the important work that you do. And what I wanted to just mention to everybody is it is our sincere goal that these meetings are not just talking head sessions, that they are truly meaningful and helpful to you, to provide you with tools in your toolbox to be as successful as possible, because you are saving lives and helping people to either prevent homelessness or address their homelessness. And so I hope that you will not be shy when we get to agenda items where we ask you for what future agenda topics should be. A lot of times when we get to that portion of the agenda, you all have so much work going on that usually you are kind of silent. And what I did today that I'm hoping can facilitate some conversation about this, I made some calls to some key leaders across the continuum of care, just kind of called them on the spot and said, if you were able to tell me what are the important things that we need to be talking about and thinking about for future continuum of care meetings. So one of the persons that I talked to today was Karen Younglow from Lighthouse Social Services. Karen, are you in the house?
Yes, I am.
Okay, well, I wanted to share some of your words of wisdom. And then if there's anything that I missed, let me know. Karen had her strategic hat on, and if you know about Lighthouse, they're in 2 different counties. So she brings perspective from both Riverside County and San Bernardino County. And so, Karen, if I understood some of the things that you mentioned that would be good for us to be thinking about in the future, not right now, how can we best prepare for change? Figure out at a greater level what capacity we have and don't have. Start having strategic conversations about changes in funding priorities and program models. And then you and I talked about perhaps linking those discussions because we're going to start working on updating our homeless action plan. Some of the other topics were how can we get housing built quicker and less expensive? I think you mentioned creative things like containers and pallets. What other plans are on the horizon? You mentioned things like focusing on substance use treatment and looking at capacity, especially empowering nonprofit organizations to know what resources are out there in terms of residential bed capacity, outpatient services, or detox beds. Did I capture everything in your good suggestions?
Yeah, Karen, you captured everything, and I was talking with Karen in light of kind of all the changes that have happened, with HUD and new transitional programs, transitional housing programs, and new mandates regarding employment and substance abuse treatment. So making sure that we know we have wonderful providers, SUD providers through behavioral health, and that's great. But also looking at maybe some of the smaller providers, outpatient providers that we're not connected to through our COC, so we can make sure that we have the capacity to treat. So yeah, I think you hit everything. Thanks, Karen.
Yes, and just so you know, I did have a chance to talk to Becky Ruiz from Jewish Family Services. Becky, are you in the house?
Yes, I am. And Karen, you hit all the highlights before I could.
We have the same mind, Becky, the same mind.
Totally. So really super important and wonderful to see you guys so strategically aligned in your thinking. Angelina Coe from Shelter from the Storm, I think you are in the house.
Yes, ma'am, I am.
I was inspired by your ideas. If I heard what you said that funders want collaboration. And I know you've got tools in your toolbox that you can share with members across the continuum of care, but you talked about things that might be helpful, like how do you document collaboration when you don't have an MOU? How can you create collaboratives with partner agencies so that you can document how their services can be leveraged, since their services are often being paid for with other funding sources, not the grant you're applying for, and even used as a match for the grant? Like, how can you do that, and how can you be successful? Which I think is a really great idea, and it's something that is on the hearts and minds of not just the nonprofit community, but government partners, everybody across the spectrum. So I love the idea, and I thank you for it. I talked to multiple providers who said that we should discuss strategies for quicker payments from government agencies. And that's across the board. And I think that type of discussion works both ways, right? From the government agency perspective, as well as the organizations that are receiving funding from those. So the suggestion was from a positive perspective about how we can have strategic conversations about developing strategies to do that. This is just the tip of the iceberg. And I hope that you guys will have feel the safety and freedom to make other suggestions. So is there anybody else out there that wanted to comment on this good feedback? Do you have other ideas? I know it's hot out and I know you're all busy, but pretty please, is there anybody else out there that has some good ideas they'd like to share in terms of future conversations?
This is Candace from CVAG. How are you?
Hey, Candace.
Hey.
Hey, welcome. Let's hear it. Love to hear from you.
Well, so I'm actually stealing an idea, and maybe they can come, but I was just at the National Alliance to End Homelessness in Washington, D.C., and LA County Mental Health Services is doing street psychiatry, and their program is really innovative in helping people on the streets with mental health, the people that we can't get to. And we really need mental health providers or some kind of program that can really work with these clients from the streets, create the relationship, even if they're put into the hospital, can, talk to the hospital, create some kind of care plan for them, and then have a place for them to go afterwards.
Are you talking about actual psychiatrists that are doctors that can write prescriptions and perform services? Like
Yes.
Okay.
Literally going out to the person on the streets, giving them injections, bringing them their medication daily, all of that.
So just want to ask our HWS staff with the cadre of street medicine and other outreach teams, other providers, do we have anything like that, or from our behavioral health friends? Just curious. Greg, I see you shaking your head. Did you want to comment?
Well, I do want to just let you guys know we do have street medicine with our healthcare and action team. They provide exactly what you described, Candace. They were first doing it through our HIP program, but later on we actually now have a Proposition 47 program that we actually later on in the presentation you'll hear an opportunity for that. But we do have our healthcare and action team alongside with Wellness Equity Alliance in the desert that provide just what you described.
But do
And
they
then
have a psychiatrist though who goes out?
and can prescribe medication, correct?
Okay, I know they can prescribe medication, but this team in LA, they literally are taking the person, their medicine every day. They're going out and they're touching them every day. Because, you know, people on the streets, I mean, unless you gave them an injection, if you're giving them medication, they're not taking it every day. You're just dropping off
Right.
a pill bottle and hoping. So, it just seemed like they even had the ability to not have consent signed by the client and to be able to treat them without consent.
Well, we can talk more about
Yeah.
that program, but we do have something similar, so maybe we can enhance it a little.
Well,
Yeah, that'd be great.
Candace, thank you so much. You're always on the cutting edge and thinking strategically. You do such a great job in the areas that you cover in the Coachella Valley. So thank you for your work. Heather, it looks like you might have a suggestion also. Let's hear it.
Hi.
Hi.
Good to see you guys. I just wanted to throw out there, since you're talking about this as a newbie, like first time receiving like a larger grant from the county, and specifically talking about the payment side, you know, the back and forth. I think it would be great if the COC might consider in the conversation of linking up like mentor organizations to a newbie organization to walk them through like hand in hand, because I don't know what I don't know. And the county has been amazing, and all the people that are on this call that have been working with us have been great and gracious. But also, I feel like the bar keeps moving for like what compliance we have to turn in, and then we do this way 1 month, and then the next time it's like, well, now we actually need this a little bit more detail. And I realize it's not them; it's more the state asking the county, okay, now we need this, and this. But as it trickles down to the nonprofit, it gets super cumbersome. So I would have loved to have, and I did reach out to a couple different people that have been very helpful in the COC to say like, hey, how did you do this? Or what did you do? But if maybe there was an actual partnership style of ability, you know what I mean? Where we could mentor, people could be linked to be mentors. Cause clear is kind and all that. And I want to be the A student that gets it correct the first time. But we've been like all over the map. We're like missing the mark and whatnot. And so anyway, that's my suggestion. I would love if there's ever like a small side cohort or focus group that talks about this. I would love to be a part of something like that, just because I feel like I'm living the experience in real time. But that's a small thought I had.
I love it. Thank you. And I love you always have the beautiful flowers and flair. Is that like a daisy? It's beautiful.
Yeah, I wear a flower every day in my hair. It's a fun story. So Karen, we should go to coffee sometime so you can hear all about it.
I would love it. Thank you. Miss Carol.
Hi, everybody. Can you hear
Hi,
me?
welcome. What ideas
Good.
do you have, my dear?
Okay, well, the idea that I would like the COC to address is follows up on what Heather just mentioned, and that is ways to include some of the smaller nonprofits in the circles of funding that are coming out. A lot of times, you know, you can see there's a lot of new people getting into this arena, and sometimes they don't even know how to begin the process of applying for funding. So one idea would be to ask some of the bigger organizations to actually partner with smaller organizations in their grant applications. And I believe that that was done in one round of some funding, but we need to do that more so that the people that come to the COC know that there's people there to help them, and that the small nonprofits, small to medium nonprofits can grow and thrive just as much as the bigger ones do. That's my
Love it.
suggestion.
Yes, and I hope that with your suggestion, you'd be willing to be a part of that because you've learned so much and have some great examples of the successes you have achieved at Faith in Action. How does that sound?
I would love to do that.
Perfect. Okay. Let's see. Nell, did you have
I
I'll
think-
take two more.
Hello,
We'll take
hello,
two more,
everybody.
Nell and then Kimberly. Hi.
I am back. Now as Caring Rose, Human Services. Nice to see familiar faces. Nice to see all of you. I see Rachana smiling over there. Hi, Rachana. My suggestion is kind of like coming from the case management perspective, right? In building relationship with clients, we build rapport, and sometimes it's very difficult to do that. So when we lead from one agency and then to another, best practices in terms of perhaps bridging that gap where you have to start over with a new client. Say, for instance, having like an MOU with a former agency, and then maybe come up with the ways to work with that same client collaborative in some fashion in order to help them get to that level of from in-house to house. I know that from my previous, my most, my last employment, there was somebody who was 20 years unhoused, which I think is such a pity that we're not able to close that gap when we can, and it's possible. And I know it's very difficult to establish rapport, especially with the 20-year unhoused person. So I'm hoping to find some best practices in which we can bridge that gap so we then don't have to jump and from one case manager to the other.
Hey, that's good. What I heard is best practices for continuity of care. Love
Right.
it.
Exactly.
Okay.
Yeah.
I'm so proud of you guys. You're usually quiet. Yay. Thank you so much. Okay, we're going to take one more, and then I hope we can continue this conversation because this is all about you and the people that we serve. Miss Kimberly, what you got for us?
Hello, everybody. I hope you're enjoying our summer. It's nice and warm. My suggestion is longer term. So we have housing first that says get them into housing and house them first. But then once they're there, they have a shorter period of time to take care of them. And in drugs and alcohol, it's proven that it takes 18 months. Most of our funding that we get does not include 18 months or 2 years. It's usually, 9 months or 12. So I would suggest, if to be successful in really overcoming some of the barriers that these clients have, yes, get them off the street, and then the case management has to go on longer. So that's all.
Okay, just to make sure we understand so we can work, bless you, together as a team, are you talking about rapid rehousing or transitional housing limits? I just want to make sure I didn't miss that, Kimberly.
It could be either. Rapid rehousing, I mean, you have to get them into housing. That's our housing first model that we all have to work with. Isn't that correct, Karen? So get them into housing somewhere, either like in a shelter, or so you can start case management, or into a house or in a housing project, somewhere where somebody can do something and be consistent, but it just has to be longer.
Okay.
So the model that I'm looking at right now with Mama's House is they take them right off the street. They bring them in. That's for pregnant women, so a lot of them have their children, but they have little children. those little children are immediately caseworked. They go to psychiatrists, and because they've been traumatized by the abuse or being on the street. The moms are taken into parenting classes, but this is a process that takes 2 years. And by the end of the 2 years, they have a job and they have housing and everything's set up for them. So we're really successful, but I don't see a lot of programs that have those type of outcomes. And I think that the reason why Mama's House is successful is because of the time that we can put into the individual.
Thank you. You guys, I'm so proud of you. I just want to say thank you. We're going to go ahead and move on to the next agenda item. Misha, we get towards the end. If we've got time, we'll come back to you. I want to make sure we get everybody's idea, but I do want to make sure we stay within our time. So we're going to go ahead and move to the next agenda item, and that is the chair's leadership spotlight. And I'm super excited to have Sue Evans, who's the executive director of Homemade Inland Empire, with us today. I wanted to let you guys know I'm a proud supporter of Homemade for many, many years. I spent a large portion of my career in Orange County, and that is where Homemade actually originated. And, you know, the Homemade is a nonprofit. They leverage donations from the building industry for both labor and materials. You're gonna to build shelters. It's a great resource. They do a lot of other things. You're going to be excited to hear about Sue. She's the new executive director. I want to tell you a little bit about her before she jumps into her presentation. She is the new executive director of Homemade Inland Empire. She's lived and worked in the Inland Empire for 26 years, where she's been the COO of a nonprofit developing child welfare and youth housing programs. She has many years of experience advocating for much needed services in our communities and collaborating with government agencies and community partners. Sue, we're super excited to have you with us. The floor is yours.
Thank you, everybody. Hopefully you can hear me okay. And I'm excited to tell you about Homemade, and hopefully this is an organization that will be able to reach out and work with some of the wonderful providers who are here today. Homemade has been around for over 35 years. And as we go through, can you move through the slides for me? As we go on to the next slide, I'm going to talk to you a little bit about what we do. We work with the Building Industry Association. So as a nonprofit, we are their kind of charity of choice, and we work alongside them to leverage labor, the trades, also all the building materials to help our nonprofit partners. So we develop, build, provide emergency, transitional and permanent affordable housing. And we're going on to talk a little bit about how we do that. And it's a pretty unique model where we can partner with you to help, you know, come to fulfillment. Some of these really challenging things for those of you as service providers is extremely difficult when you're looking at building or renovating your existing facilities or building new ones. You're in a very difficult position. It's hard to get loans. It's hard to get money. So this is a really great partnership to increase the much needed housing supply in our community. As we all know, homelessness remains a major crisis here in the Inland Empire. We have sadly seen it grown as our population has grown dramatically over the last 20 years. And all of you are doing an amazing job in different ways, helping with the crisis that's going on. But as we know, there is not sufficient housing supply. So there's always a need for more. Over the years, we've done about $19 million worth of projects, created 756 beds, and it's at a fraction of the cost. And I'm going to go on to explain kind of how this works. We do renovations. We've also helped with other building projects that help with that issue of homelessness or those at risk of homelessness, including food banks, clinics, but mainly it is to do with housing, shelters, affordable housing, transitional housing. Can you go to the next slide, please? So we have three areas. We're interested in partnering with our service providers We do the housing construction, so we work with the building partners and the service providers to bring you together to help discount deeply and help those shelters and that transitional housing get built. We also do a lot of community engagement. I've been involved with some of you doing essentials drives. We do big diaper drives. We're in the process this November for Homeless Awareness Month. We're actually going to be doing care packages that we will be distributing to all our service providers. And we work along service providers to really advocate and bring education and awareness to the risk of homelessness in our communities. So if you go on to the next slide, great. And just to give you some idea, Homemade is nationwide. We're continually expanding. We're in about 20 different states at the moment. And as was shared earlier with Karen, it actually started in Orange County. But the Inland Empire, we have been there for since 1990. So we've been there quite a long while doing various projects. And we aim to do several projects at a time over the year. And as you know, some projects, if it's from ground up, could take several years. Other projects, it's a renovation. We're going in and we'll talk about some of those projects we've done to give you some idea. So if you'd like to go to the next slide, please. So we offer this unique cost-effective solution. So we're a nonprofit. So we work with the building industry and our service providers and our community leaders. And our whole goal is to help people at risk or of experiencing homelessness or those at risk of. And it's a really unique program. So if you go on to the next slide, I'm going to explain kind of how it would work for you as service providers. So on our website, we have applications. So you as a service provider may be needing to renovate. Maybe your shelter is in need of a new roof. You're in need of a new kitchen. You're in need of new lighting. You need some refurbishment. So you would apply. We would recruit from the building industry, a builder captain, and we develop a project budget. We see how much we can get donated. We do a letter of agreement with you. Obviously, if it's a large campaign you're building new, we expect to see that you have some capital campaigns going. If it's a renovation, not necessarily. We do a letter of agreement with you, and then we work with all the trade partners to bring them in to donate. And once it's finished, we'll do a dedication ceremony. Homemade is involved in that. And then how Homemade works to sustain is any donated amounts that are given in the agreement, it's about a 10% goes back into Homemade to help our next project. So it's like a pay it forward constantly in order to help us continuing to do so many projects. To give you an example, for a renovation, you could get as much as 80% of the materials and labor donated. For a new build, it could be somewhere about 50, 65%. So it is a huge amount, and we have access to a huge amount of different trade partners, building. There's a lot of new building going on in the Inland Empire, and they want to give back to the community, and we're kind of the way they're giving back, which is wonderful. So it can be a lot of assistance for those that are looking to build or to renovate. Can you go on to the next one? I'm going to talk a little bit about some of the projects we've done. We work with all age groups from homeless families, women's shelters, youth housing, seniors, veterans. We just completed a project. It was a large project in February, Operation Grace. And this was a recuperative transitional housing for seniors. Operation Grace had purchased a very rundown property that needed a lot of work doing to it. That was opposite the hospital. And Homemade came in and got a lot of the building work donated, a lot of the supplies donated, and this was able to be dedicated in February and is a wonderful project that will offer the opportunity for some seniors who are being discharged from the hospital to be recuperated in a safe environment, because those seniors would have gone into homelessness. So just to give you some idea, and that house needed complete refurbishment, and that's what was worked on. If we go up to the next slide, just to talk about some upcoming projects. These are some upcoming projects that we are looking at. And as I said, some of these are refurbishments and some are new builds. If you'd like to go on to the next slide. One project that Homemade were able to link one of the large builders was the Coachella Valley Rescue Mission. They needed to refurbish one of their women's shelters, and we were able to link them with the builders to go in and put in new windows and lighting, and that's in process now. And this shows you the picture of us donating some of the essential supplies that we were able to collect for the community. And again, I think that project was pretty much going to be almost 100% donated, which is wonderful. If you'd like to go on to your next slide. Project Touch, so some of you may know, offer many of the services in South Riverside County, providing emergency transitional housing and support services. And they are in the process of building a much needed emergency shelter and transitional housing in South Riverside. And we are going to start to be involved with them in helping build this project. It's going to be a huge project involving multiple different layers over a period of time. So we're very pleased to partner with them and help them with some of those supplies and building that much needed shelter. If you'd like to go on to the next slide. Crest Cottages is another project we're working on together with Olive Crest, and this is a church community partnership where there is land there and they have permission to build some cottages for foster youth who are transitioning out of foster care, including some parenting youth. And we're going to be involved in bringing in some of the trades to help with the cost of building those cottages, and that's in process as well. If you'd like to go on to the next one. Inland Valley Hope Partners. This is a renovation project, and this gives you some idea of what we can do for renovations. This actually is in Pomona, so just inside at the end of San Bernardino, LA County. And they desperately need a new kitchen. We're working with builders to try and cover the cost of renovating and refurbishing their kitchen. And we should be able to get that, we're hoping, mainly all covered. Again, that's, you know, what we can do with the smaller projects. We're able to help get a good percentage covered through our trade partners. They often have surplus materials, or they're building many houses, they have surplus, and they're more than happy to donate and help with labor to get those into our service providers. We want to talk about some potential projects that we need your help with in Riverside. If you'd like to go on to the next slide. Riverside City do have some plots of land. They have a plot of land they would like to work with Homemade on called Victoria Village in the city of Riverside to develop some transitional housing for single adults or seniors. And we would love to find a service provider to work with us to help get that to fruition. It's much needed, some more senior transitional housing. So if anybody is interested in working with that population and would be interested in looking at developing some transitional housing, please email me. And again, we have our application on our website and my email is there, and I would be very happy to talk with you. Ways to get involved. We do a large essentials diaper drive. We've just finished. We were able to provide thousands of diapers to some community service partners last month. And as I said, in November, we're going to be doing another very large essentials drive. This time we're doing care packages for adults. So we'll, you know, if you're interested in partnering with us to receive some of those, again, please let me know. So last slide is ways to get involved. Partner with us. We are interested in working with more service providers. As I said, our applications are available, or if you're not sure, just give me an email and I can talk you through what types of projects we could work on. Follow us on social media, see what we're doing. I've put our website, our LinkedIn, our Instagram that leads to our Facebook all up there. Follow us and see what we're doing. We also put up there a link into any service providers we're working with to get more visibility. We know there's a huge need for an increase in housing in our communities, and we are here to help. So with that, I'd like to open it up for any questions anyone might have.
Questions, anybody? Well, oh, Kimberly, go ahead. I think you're muted, my dear. Kimberly, did you have a question or a comment? Might be having technical difficulties.
No, I'm sorry. I wanted to say, Susan, where have you been? We're really thrilled and excited about you, and you'll probably be getting lots of calls. So thank you very much for your presentation.
Yes, please do. Please reach out with us. We really want to work with more service providers in the area. It is a wonderful opportunity to really help. As a service provider for many years myself, it is extremely difficult, as you know, to get funding. Very difficult to develop and refurbish and get the funding for that. So this is a really good joint project between our private building communities who really want to give back and are very generous and have done a lot of work on our projects. So we really want to partner and increase our housing supply in our community. Our goal is to see an end to homelessness, like all of us here.
Well, and just love to give a plug again. I mean, when we think about what it takes to get shelter in the ground, you know, a collaboration usually with cities and county agencies, and what a great way to showcase a private sector solution that can come and help and do a portion of the heavy lift. It's a really beautiful model. Sue, I know the board is super excited about having your leadership as part of this organization. I am too. I wanted to tell you that Scott Larson says hello. Scott Larson is with National Homemade because they have chapters all across the US, as you saw, and he's part of the Inland Empire now. He used to be in Orange County. Now he's out here with us. So I just talked to him recently. He was super thrilled to hear that Homemade IE was presenting before the Continuum of Care today and said to say hello. So anyways, we're just delighted to have you at the table, and we look forward to continued conversations and collaboration, Sue.
Perfect. Thank you so much. And I look forward to seeing you in future meetings. And don't hesitate to reach out by email. I've put my phone number down there, and also look at our website and hopefully hear from some of you soon. We really would like to do some collaboration, especially with the city of Riverside, with this land that they have. Perfect. Thank you.
Thank you. Okay, Clarice, let's go ahead and move on to the next agenda item. Okay, we have new business, Continuum of Care Board of Governance nominees. Roshana, you are on deck, my dear.
Thank you, Madam Chair. Good afternoon, everyone, again. Thank you for joining us today for our monthly Continuum of Care meetings. My name is Roshana Walker with the Office of Homeless Services, and right now we are in election time for our expiring Board of Governance seats. So we put out a call for nominations to fill our public sector seat, which is behavioral health or primary health, as well as our nonprofit sector seat, and we received 7 nominees. We did invite those nominees to this meeting to share about 2 to 3 minutes about their background and their interest in joining our board. I also just want to mention that we did put out a call for nominations for our private sector for the affordable housing developer, but we didn't receive any eligible nominees for that seat. So we will be putting out another call for nominations for that seat at a later time. Before I call on the nominees, I just want to share the board's responsibilities. So our BOG, or Board of Governance, currently consists of about 14 members that meet with our team every other month, as well as special meetings that are needed to review our policies and funding recommendations that are critical to our continuum of care programs, such as our street outreach, emergency shelter, or rental assistance program. So they play a critical role with the delivery of our services and our funding recommendations and policies, reviewing policies for our continuum of care. So first, I want to begin with our public sector seat, which I believe Marcus Cannon is here on behalf of Dr. Chang to share a little bit about Dr. Chang, who is already a current member, but his seat is expiring.
Hi, good afternoon. Thank you, Roshana. I hope you can hear me all right.
Loud and clear.
Okay, great. I've had some trouble with my microphone. Dr. Chang is the director of RUHS Behavioral Health, and he has served on the Board of Governance for the last several years. He had a conflict today and couldn't be here, but asked if I could make a couple comments on his behalf. First of all, we're just grateful to the leadership of HWS for their leadership in leading and supporting the continuum of care. So we're grateful to partner with them and have a seat on the Board of Governance. His term had come to an end, but he wanted to run again and be available to serve again if that's the wish of this group. You can see a little bit there on screen about Dr. Chang's bio. He's trained child psychiatrist as well as board certified as a forensic psychiatrist. And what I think is helpful about that is he understands working with individuals all across the age range, from our youngest children to our oldest seniors. He's worked extensively inside the Riverside County jail system, which unfortunately, there are many people who are homeless who also have had stays in the Riverside County jail system. And I think that's an unfortunate but really important to have that knowledge about what that criminal justice system intersection is like with behavioral health and with homelessness. He's also served as a psychiatrist in our Banning clinic in years past prior to becoming our director. So I think all those experiences are helpful to provide some firsthand knowledge of serving individuals who are homeless, who have behavioral health and substance use conditions. I think his role as the director of our UHS behavioral health across the county is a useful vantage point to be able to bring healthcare, medical care, behavioral health lens to the conversations that happen at the Board of Governance. And so those would be the things that I would share as strengths that Dr. Chang brings with his perspective and with his training. And again, he just asked me to express his gratitude for the opportunity to serve on the Board of Governance these last years, and to express his willingness to continue to serve if that's the wish of the voters. So with that, I'll keep it short. Thank you, Roshana, for the opportunity to share a couple of remarks on behalf of Dr. Chang, and thank you to the HWS team for all you do to facilitate and make this process happen.
Thank you, Marcus. And our second nominee is Vanessa Castro. Vanessa, are you on the line?
Hi, good afternoon, everybody. Yes, I'm on the line, and I do apologize. My camera is off. I am recuperating after a minor incident. So I do apologize for that. But my name is Vanessa Castro. I work with National Core Hope Through Housing. And I have been there with them for about 4 years. But prior to this, as you guys can see, my background is really at vulnerable populations, working with the coordinated entry system in San Diego and the implementation of COC funding programs across San Diego, Las Vegas, and San Bernardino. And now I work with, like I said, National Core Hope Through Housing and permanent supportive housing for individuals who have, of course, struggled with homelessness and mental health in the past. So my experience has been lengthy, like I said, with seniors dual diagnosed. So that is my primary focus in the past. But now we work with all different populations. And again, I do apologize if I'm rambling, but I'm going through this process here. Some other things that I can probably bring to the table besides my experience with the programs is I have spent about 10 of those years with compliance, implementing policies and procedures, better practices across those regions. Like I stated, in Las Vegas, I did that for about 5 years, in making sure that we, coming from a deficit, will bring it up into compliance and a pocket of uh, funding for emergency funding. So again, that is kind of something that I bring. I have a lot of passion for the population in the regions that we served, not just because I have worked in the administrative portion, but I have also been boots on the ground and literally doing outreach. So again, the work that we do across our regions in order to help the individuals in the programs that we serve are something of great interest and focus for me. Um, and I do apologize. I forgot the last portion that you asked. Oh, what will we bring? I believe you said bring to the table or, so again, like I said, it will be my experience in compliance and implementation of programs from beginning to end and making sure that funding and standards are met. So I hope that answered. And again, I do apologize. I am not in my best moment, but this hopefully will cease to exist soon. Thank you.
Thank you so much, Vanessa. And those were the two nominees for the public sector for behavioral health, primary health provider, and our social service providers. So moving on, we're moving on to the nonprofit sector, and I'll ask if Carol is on the line.
I am on the line. Can you hear me okay?
Yes, loud and clear.
Okay, great. Hello, everybody. My name is Carol Albaugh, and I am currently serving on the Board of Governance to represent the nonprofit sector. And I would very much like to represent this group again for a variety of reasons. Number one, this position has allowed me to understand the total landscape of what's going on in the county. And that has been very valuable as I work in an area that is often overlooked in terms of funding and services, and that is the San Gorgonio Pass. About 5 years ago, our nonprofit grew out of the COVID epidemic, and we started on a stage at Carol's Kitchen and had to work through several layers to get to where we are today, which is still a mid-size small nonprofit. And I'm passionate about bringing the nonprofits like ourselves along in the journey that we're taking here in Riverside County, because I think the smaller nonprofits, we bring a voice to the we bring a voice that other larger nonprofits can't do, because we are able to give that personal touch and spend a little more time with people. So the way that I would like to represent you on the BOG is to continue what I'm doing now, which is always looking out for the smaller nonprofits, how they can get involved, how they can get connected to these funding opportunities, and events and changes that can make a difference in how we operate our organizations. I'm like the rest of you, spend sometimes 80 hours, a week working to keep things running. And I understand what many of you are going through, and am willing to mentor those that maybe want a little bit of assistance. Not that I have answers, but I sure will listen. And that's what I want to do as I continue to serve on the non-sector board. The other thing I bring to the table is that, as you can see by the picture, I'm a senior citizen. And so I think that represents a perspective also, because I'm all about empowering others. and I'm all about making sure that the small nonprofits bring a very unique perspective to the Board of Governments. So that's it, guys. Thank you.
Thank you, Carol.
Who's laughing at me? Who's laughing? I'm joking.
I don't know who's laughing. It certainly wasn't me.
I heard giggles in the background.
I thought it came from your box because it lit up, but it's okay. No one is laughing at you. We love you, Carol.
Okay.
Next, for the nonprofit sector, if you can advance to the next slide, we have Mr. Eddie Estrada. Are you there on the line from Step Up?
Yep, can you guys hear me?
Loud and clear.
All right, well, good afternoon. It's an honor to be considered to sit on the board, so thank you for your consideration. A bit about me, I have more than 25 years of executive nonprofit leadership experience, advancing housing, improving behavioral health and healthcare outcomes, and strengthening systems of care for our most vulnerable population. In my career, I have led large integrated initiatives that align with housing, healthcare, behavioral health. I collaborate with counties, healthcare system, behavioral health system, housing authorities, public agencies to expand permanent supportive housing, homelessness prevention, and data-driven interventions. I currently work as Vice President for Step Up, and I oversee approximately 20 projects across Northern and Central California, Riverside County, San Bernardino, and Orange counties. Our service delivery model is comprehensive and includes outreach, temporary housing, rapid housing, permanent supportive housing, chronic disease management, and mental health programs. And the population of focus ranges from adults to seniors at risk or experiencing homelessness, including those with chronic homelessness and severe mental health. For our San Bernardino project, we have a HUD program, and that strictly focuses on chronically homeless individuals with severe mental health issues. Prior to coming to Step Up, I worked at US Vets, where I was part of a team that launched 3 new housing sites, which expanded permanent housing to our veterans. Roshana was part of that back in those days. Prior to that, with the Los Angeles mission, I was part of a leadership team that secured Skid Row Housing's first healthcare for the homeless FQHC designation. And a FQHC designation is a designation that's given by the feds, and it's to provide medical services. So while there, we expanded our FQHC designations to probably about 5 in totality. And then I was part of a team that implemented Skid Row's First Street Outreach Medicine program, that it did include a psychiatrist and doctors that were in the field. So glad to hear we're moving in that direction. Also, I served on the Riverside County Board back in 2013, 2014, and I worked closely with that board, including many people around here. Karen Lowe was part of that, where the county became the first county, became one of the first, if not the first county in the nation to be officially designated as achieving veteran functional zero. As a COC board member, I would bring deep experience in strategic planning, fiscal oversight, contract management, and compliance, and cross-sector partnership development. One thing I value working alongside my peers on setting policy direction, system oversight, funding decisions, and ensuring compliance with federal, state, and county requirements, all while alignment with Riverside County's 5 strategic priorities. And I want to end with this, just like Vanessa Castro, I wasn't always in administration. I actually have over 10 years being boots on the ground as a not substance abuse, but as a gang counselor, outreach worker, and a case manager in Skid Row. So thank you for that, for your consideration.
Thank you, Eddie. And up next, we have Dr. Christina White from Grit House Foundation. Are you on the line? Well, she's not on the line, but you do have this presentation. You will have this presentation on the Google Drive so that you can read up a little about read her bio. And next, let's see, is Dr. Patsy Elliott Brown. Are you on the line?
Yes, I am.
Good afternoon. Take it away.
All right. Good afternoon, everybody. I'm just delighted and privileged to be part of this opportunity to be interviewed, to be on the board. My background, just briefly, I like to talk a little bit about personal interest in homelessness. My mother suffered from paranoid schizophrenic, and she was on the streets of Detroit, Michigan for over 10 years, and we didn't know where she was. And when I did recover my mother, the effects of homelessness dug deep into my psyche and my emotional makeup. And so homelessness, families with homelessness, children with homeless issues mean a lot to me. Having said that, I'm a pastor of a church that I founded for over 45 years. I have over 25 years as an executive in the Head Start programs, which blended funding and federal and state funding as well. I'm very experienced in compliance issues when it comes to not blending money, not co-blending money, and keeping compliance for your grants. Having said that, as a pastor, we have always done community outreach, what we call feeding the homeless. And I also want to say I'm the chairperson of the Moreno Valley Citywide Coalition. And in that coalition, we have the secular nonprofit and the religious nonprofit. And in that coalition, we also do a lot towards feeding the homeless. So we're like boots on the ground. I heard a lot today about organizations and small organizations that are for the homeless structures and projects, and we have some on the back burner. But our main interest is the actual person on the ground in the throes of homelessness. So we deal with emergent, urgent, and immediate feeding, urgent and immediate medical care. So we deal with the actual one-on-one person in the straits or in the throes of homelessness. One goal we have is that I'm working with the churches in the community of Moreno Valley to form community development corporations, nonprofits. And that is to formalize the outreach that they do to the homeless so that we can get in a position to have what we do on an ongoing basis funded wherever funding is available. And so I've been doing that again for over 40 some years, feeding the homeless, dealing with the actual person that's on the street. In the Head Start program, we had a lot of families, a lot of children, a lot of pregnant women that were homeless. And again, through that program, we provided mental health, we provided afterwards a pathway to employment, pathway to identification, because at that time it's a little bit different than it is now. At that time, a homeless person without identification could get services. It's not that way now. And so as well as what we do on an ongoing basis, we provide opportunities for people to get their birth certificates, to get their any kind of ID where they could qualify for any type of subsidy that they may need. Currently, what we found out in Moreno Valley is that people without identification usually slip through the cracks of what is available for homeless people that are on the street, because we know there's different types of homelessness. So what we've done is we set up a coalition with the certain the Department of DPSS, I guess you could say, and we have some workers that we co-work with to get people their ID, their identification So hopefully they can get some type of Medi-Cal, maybe some food stamps. They do have a limited program available for homeless people for food stamps. It's not the same as SNAP because you have to have a place to store or cook in order to have SNAP. So we're trying to work around that. So what do I bring to the table? What I bring to the table is a background in compliance with federal government contracts. I've had over 45 sites, worked in Bakersfield, and we covered some parts of northern San Bernardino, all through the Bakersfield area. And in those sites, we had different regulations in different parts of the county up there, as well as with the county that we have down here in Riverside County. So I believe that I bring to bear a unique understanding of the urgent and immediate need of that person that is homeless on the street. We know they need housing. We know they need to be in a program, but they have emergent needs that need to be met. One thing that I found out about my city is that a lot of our homeless money was being moved over to Riverside City because they had a more stringent program for the homelessness. And I'm working very hard to keep the monies that come through our city in our city so we can meet the needs of the person that's in our city. So I don't know what else to say besides that, except for I believe that my executive experience, my hands-on experience, my experience as a pastor providing moral and spiritual support for those that are in need and homeless and feel desperate and have nowhere to turn. I believe I bring that to the table, and I'll be a voice for that person that has the urgent and immediate need in those programs that will meet those needs. I heard a lot about people giving medical attention to people and giving them daily doses of medicine. Problem with that is homeless people don't stay in the same location day after day after day. And a lot of those programs we've seen fail because you cannot go to an address and give those persons medicine. So I believe I bring that expertise, that window of insight to the program, and I would count it an honor and a privilege to serve. I would count it an honor and a privilege to be able to help other small nonprofits, as we are doing in the Moreno Valley Citywide Coalition, stay compliant so that we can keep funding. And I believe that we can solve the problem of homelessness in the United States of America.
Thank you. Thank you so much, Dr. Patsy. And last but certainly not least, we have Joshua Squires. Are you on the line? Joshua, are you on the line? Well, again, you will have all of this information. Their bios will be posted on the Google Drive. I do want to thank all of our nominees for their commitment to wanting to serve on our Board of Governance, and also thank them for the work that they're doing currently in Riverside County. So thank you, thank you, thank you to all of our nominees. I just want to let you know that the ballots for voting will be shared within the next day with a deadline of 2 weeks. About 2 weeks, the voting will be open, and then we will share our results in our next COC meeting. With that, I pass it back to you, Madam Chair.
Thank you so much. Okay, let's go ahead and move on to the next agenda item. Agenda item under 5.2, and it's the HAST introduction, the new data sharing agreement. The wonderful and amazing Monique, you have the floor. We're so excited to hear about this. I know this is many months in the making. So we're excited to hear about all the good stuff you have to present. Take it away.
Thank you so much, Madam Chair, and thank you so much for having me. If we can pull our slides up, please. Awesome. Thank you. So hello, everyone. My name is Monique Rodriguez Torres. I'm with Riverside University Health Systems Behavioral Health. We are the CES lead agency. I do have some very special guests with me today, and together we are going to walk you through our progress on the HAST. That is the new vulnerability assessment tool our Continuum decided to replace the VI SPIDAT with. For those of you that are new here, or those of you who have been patiently waiting on an update from us, this is that update. So I am eternally grateful to you all for your grace along with this process, because it has been a long time coming, as Madam Chair has let us know. Next slide, please. All righty, so this is going to be a really quick roadmap to what we're going to do today. First, I'm going to introduce you to our contracted partners who are building and validating the tool for us. They will walk you through what the HAST tool is, how it stacks up against our current VI SPIDAT, plus what we've learned so far with the initial analysis of our system. After that, I'm going to come back and talk you through our training rollout planning. I will then close us off with asking for COC approval to move forward with the data sharing agreement that is needed to keep our model validation process moving forward. It is a pleasure to be working with and to introduce you to our partners, our social data analytics, or SDA for short. Next slide, please. All right, and Miss Larissa, if you'd like to take it away.
Thank you, Monique. For the change of plans, I'll hand over to Rima.
Hi, everyone. Thank you very much for having us. It's a real pleasure to share with you where we've got to so far and to request the agreement to us having a data sharing agreement. My name is Rima Vaityanathan. I'm a professor in Auckland University of Technology, and for almost a decade I've been working in research and also supporting agencies like yours who want to adopt a more data-driven algorithmic decision making. So I work in human services, child welfare, and homelessness. And Larissa and Zoe, who are on the call, are part of our team, and we've had the pleasure to work with Monique and her team for a while. So what we do is we develop and implement sort of end-to-end predictive risk model, and communities come to us, especially when they want to use their integrated data better, or their administrative data, so that they don't have to constantly be asking kind of invasive questions of their clients, and also so that they can be more informed about client history in order to help route clients and triage clients to the right services. So we've spent over a decade building and validating prioritization tools for homelessness, child welfare, and mental health agencies. We started in Allegheny County in Pennsylvania. They've been using a HAST now, which they call the Allegheny Homeless Assessment Tool, the AHA. We developed that around COVID time, so 2019, and they've been using that since then. And we've also migrated that to also support their identification of high-risk clients for expediting them to mental health funded housing as well. So we've sort of moved to mental health system housing. So as I said, we have that as our track record, and agencies both use our homelessness tool and our child welfare tool. And in California, Los Angeles, and San Francisco, we're working with Los Angeles on our homeless child welfare tool, and San Francisco on both those tools. So next slide, please. So I guess for those of you not familiar with the ins and outs of screening tools used at coordinated entry, so HUD requires COCs to have some kind of screening or prioritization tool to be used when clients come in and get assessed for PSH, RR, and other services. So typically the field has, for the last probably more than a decade, been relying on a tool called the VI SPDAT and variants of it. Some people have been just using the SPDAT and others have had their local versions, which are sort of the similar idea, which is where clients are asked a range of questions. Their answers are weighted, so some question and answers get more weight than others, and a final total score is generated based on kind of that point system and the answers. So research, including my research, has shown a few challenges with that tool. And so even the providers of VI SPDAT have been moving away from using that because of concerns over racial bias that has been documented in some communities. The fact that those weights are the same wherever in the country you go, so there's nothing to say that those tools are developed for the realities of the local system, and that it relied a lot on asking the same questions over and over again. So we have built an initial tool for Riverside where we've replaced a lot of those VI SPDAT questions and answers from simply taking information from the existing record that the client has in the HMIS system. By doing that, we saw that we could move away from such an expansive set of questions as the 27 questions and restrict ourselves down to 10. And so it gives us that ability to combine administrative data and continue having clients self-report. The reason we continue to use self-reports is that there are still information such as on vulnerabilities such as disabilities, mental health needs that are not well captured by looking at the HMIS. So essentially, the tool that we are proposing will use housing history and a range of selected risk factors to generate a score. One of the questions that a lot of our COC partners have is what happens when people are new to our community or just simply have avoided being involved in the HMIS system. And we do have what we call an alternative HAST that can be used in those situations. Next slide, please. So as I said, the challenge with the VI SPDAT is that it relies only on those 27 questions. It means it's quite a long assessment. You have a lot of repeated questions. It has poor validity in the literature now, in that it doesn't seem to be that correlated with the kinds of outcomes that we would want to show more vulnerable people as being more likely to experience. And it's difficult to update it in the sense that those weights are generated and held constant. Next slide, please. However, the fact that Riverside and other communities have been using it, it's not a sort of a mistake, as it were. It's reasonably predictive of future homelessness and jails. So here what I've done is a little, bear with me. I always bring data to meetings. So what I've done is I've gone back and looked at the VI SPDAT scores that assessed clients in Riverside who were assessed between 2020 and 2022 received. I've classified them into 3 groups. High, meaning they were in the highest 1/3 of scores. Middle, meaning they were in the middle 1/3 of scores. And low, meaning they were in the lowest 1/3 of scores. And then I followed them in the data from the time we assessed them through to 2025 and recorded what proportion of them did end up coming back and, for example, being seen in shelter or street after receiving that score. So what you see on the left-hand side is that around 18% of people who received a high or middle score by the VI SPDAT, around 18% or 0.18, came back and were seen in shelter or street. Whereas of the low, it was more like 12%. So you can see there is some discriminating value in the VI SPDAT. The middle, what we have done, which is quite unique and very exciting for Riverside, is because the CE data sits in a behavioral health data system, we were also able to follow those clients into mental health inpatient admissions. Now, they were not all mental health inpatient admissions. They were simply ones that occurred within the system. So if they had out-of-system admissions, we didn't see it. But unfortunately, what you see in the middle is what we've seen in other systems as well, where we worked with the VI SPDAT. People who are scored as high risk are as likely to be admitted for an inpatient mental health stay as those who score a low risk. So the VI SPDAT is not very discriminating. It's not at all able to discriminate on riskiness of mental health inpatient outcomes. And the final one that we did is we took our Riverside clients who'd come in to send us coordinated intake and match them with jail data from Riverside jail information. And then we were able to assess how well VI SPDAT was able to identify people who are vulnerable to jail involvement. And as you can see on the final graph, there was some ability of the VI SPDAT to discriminate. So all that to say that VI SPDAT is doing a reasonable job, but not a great job, especially if mental health is something we're concerned about. Next slide, please. So as I said, the move away from VI SPDAT is not necessarily that we want a more predictive tool, even though we do. We are also concerned about the high information burden. We are concerned that we're not able to validate and revalidate it for the Riverside population. There was this research evidence of bias, and we didn't use the client's history and administrative data to reduce the burden on them. So every client is treated like we'd never seen them before, and that's sort of not in work I've done with client communities. They certainly say that they often say that it becomes quite re-traumatizing to constantly be asked and answer questions like this. So next slide, please. So as I said, the one we waiting to get data, and this is why we're presenting today, because we need to get data approval. So we have received some early data. We've shown that we could restrict the the HAST for Riverside to around 10 questions if we can also include administrative data from HMIS. So we think that it keeps it a shorter question, and it allows us to reweight those as data comes in. So the early model might not be very as good as it could be as more information is collected over time. Now, the evidence base for HAST, for example, in reducing racial disparities, there's published papers from the Allegheny County use of the tool, which showed that as a result of introducing a HAST type tool there, we ended up serving more Black clients were more likely to be scored a high risk than they were when they were using a VI SPDAT, and it did pivot the system to be more have higher rates of move-in amongst Black clients. And I'm happy to share that paper with anyone who wants to read it. I also have, we've published a paper showing that one of the reasons the VI SPDAT has the racial bias is because we have shown that Black respondents, especially Black female respondents, systematically understate risk factors in response to questions. So that's something we will need to take care of even here, because as you know, as I've said, we are still asking questions. So once we have data approval, we will have to look at kind of what we call fairness analysis, which is something we always do before deployment. Next slide. So this is our early version of the model. As you can see, it's if we were to say high risk in the HAS score is who we should focus on, then high risk in the HAS score has higher rates of homeless recurrence, higher rates of mental health inpatient use, and on the jail involvement, it has similar to those scoring middle. So it's not as discriminating on the jail involvement as we would like it to be. And we will work to understand why that is and improve upon it. So this is an initial analysis. I can't show you fairness analysis that hasn't been conducted yet, and we will need to separate out adults and family as well. So next slide. Okay, that's me. Thank you.
Thank you, Rima. So I will take us away for all of the agencies and what does this mean for you that are service providers. So what happens to the day-to-day, the biggest takeaway for me as a part of the behavioral health department, who is also an agency, a service provider agency ourselves, is that the HAST is not going to require a new system, a new platform. It's not going to need another login. There's no new workflows that are needed to learn. It lives inside Clarity. It lives inside our HMIS system, just like our VI SPDAT does. And beyond the no extra work piece, SDA has built something for us that is more data-driven and evidence-based. It's more trauma-informed without having to ask all of those sensitive questions multiple times, 3 times over from what the HAS tool will be. Self-report is shorter, as she explained, and not only does that help our members, but it also helps our teams who get burnt out with asking these sorts of questions as well, because they take a lot of this home. And so there's definitely a good benefit to our service providers that are boots on the ground. Next slide, please. All right, so this system is built to grow. We are not going to set it and forget it. That is the beauty of the HAST. It is phased, and every phase we will get better. So our current phase 1 right now, is the HAST tool is built in HMIS, using HMIS data in the screening process, as Rima explained. Phase 2 is where we will do the operational deployment and field validation, putting this in front of our staff and seeing how it performs in real conditions. Phase 3 is where we're going to start looking more at a consolidated record and pulling from validated data sources just that are beyond HMIS, such as our behavioral health, like automatically our behavioral health data, jail data, any data that we are able to get, so that way it makes our system stronger. We're looking at things like detention, justice, coroner, mortality data, healthcare utilization. The idea is that any information that we can feed into this tool will strengthen it and have us be able to assess who are those that are most truly vulnerable. And I'm really excited to head there. Next slide, please. All right, so as speaking about training, we want to hear from you, and we're going to send out a survey very soon. On the training and support side, we are planning live training sessions, hands-on practice, job aids, office hours, refresher sessions. But we want to know from you, our COC, our Continuum, how do you want this rollout to play? Do you want us to roll out the HAS tool when it's ready to all agencies? Do you want us to do a pilot group that can kind of phase it in so that way we can test out all the bugs and then distribute a final version to everybody once we've tested out all of those bugs? So we do want to hear from you on that. So we will be sending out a survey to see what your thoughts are on the rollout. Also, we'll send a survey out for how do you want to be trained? Do you prefer live training sessions, hands-on practice, job aids? So kind of looking to see what you all want to see from us, from your coordinated entry system, so that way we can deploy that to you all. Our goal, if all goes well and you allow us to do the data sharing agreement, we get that approval today. We are hoping to roll out those trainings in either mid-September or mid-September or early October, hopefully, of 2026. Next slide, please. Alrighty, so hopefully we have gotten you all excited about the HAS tool. It is not all rainbows and sunshine. It is a fair question that I'm sure that you all will ask about about how predictive the tool is. How does it work? Does it work equally across different age group or different groups, such as race, gender, DV survivors, veterans, TAY, all of those populations of focus that some that are not less connected to approval of the data sharing agreement, and we will be able to answer that. So right now, subgroup population for our county has not been completed because the SDA group does not have the data that they need to be able to run those tests. So the validation is exactly what the data sharing agreement we're asking you to approve today enables us to do. We are not moving forward with full implementation until we've confirmed that the tool performs equitably across platforms and populations. That is a firm commitment from us to all of you to provide you the most comprehensive tool that we possibly can. Next slide, please. Okay, so here is where we land today. So what we need from you is COC approval to proceed with the data sharing agreement so that we can share the BI-SPDAT data with SDA for continued validation purposes. This data agreement has already been approved on our end from County Behavioral Health and our HMIS partners. We just need the COC's approval to keep this process moving forward. And Salam is ready to go with that data sharing once you give us the word. So, Madam Chair, if we can go ahead and start with that approval process, I would appreciate it.
Yes, so a couple of comments before we open it up. I just want to, Monique, you and your whole team, thank you for taking the time that is needed to do this right. This is extremely complicated. It has big implications. It's a big, huge system. It's a lot of work. So I want you all to know that the time that they took was necessary, and you can see that they're trying to be very, very proactive to make sure that everybody at the table can understand where we've come from and where we're going. So I can't even imagine the thousands of hours that you guys have put into this. So I just personally want to thank you guys for all of that. And if it's okay with you, I'm wanting to see if there's any questions from the group before we move to action. I have like a question. I don't know if it would be directed more to your consultant, but I just wanted to throw this out there. If you have someone that's off the grid that has not hit, the hospital systems or, the social, the justice systems, right? Prisons, jails, if they've totally off the grid, and yet that they're very vulnerable because of how they're presenting, how do you factor that in so that the data is not skewed? We have seen people long-term that have been totally off grid. So I'm curious to know how that works. And then I'm hoping others, if you have questions before we move to action.
Oh, thank you for that question. That's one that is quite challenging because we could go to asking vulnerability questions. We have a few alternatives. We have a paper and pencil question only. The challenge, as you could understand, is for us to validate that that paper and pencil version is the same as when you use the when you use the HMIS mental health history, because there are so few people in that situation that we end up sort of having to really work with the CE group. One of the easiest things is to just do exactly what you're saying. When a frontline CE worker feels that this score is not reflective of the vulnerability of the client in front of them, we allow the system kind of allows them to escalate that into a kind of a qualitative statement about vulnerability, which can then get that client into the same pathway as if they scored a high score. In Allegheny County, we call that kind of a client override. And then they can work through into, and we can collect client override data and review it for bias. I have to share that you can see that in the Cheng article. When we did that in Allegheny, there was bias, racial bias in who was given the override. So white people were more likely to be given the override than Black clients were. We then tested to see if that was because the tool underscored white people, therefore they were more likely to need override. We couldn't sort of reject or accept that hypothesis. So we kind of suggest, given the research, that yes, we allow that override. We allow, but we continuously track the override to against other information. So I'm sorry I don't have an easy answer, but that's sort of where I think I want to give you a research justified answer.
Thank you, Rima. And I'll speak from a CES standpoint as well. So the prioritization process also, like the case conferencing aspect, will not go away. So to Rima's point, if somebody does not believe that the score is reflective of them, CE does still have our process for requesting a prioritization review. We can do a case conferencing and identify what exactly the barriers are. What are they seeing that the tool is not showcasing? So that way a group of individuals can make that determination together.
That's awesome. Looks like, Nell, did you have a comment or question?
I actually have a question. Nell, Karen, Rose, everybody. Not so much on the gender spectrum, but on the racial spectrum, but the gender spectrum. I know one of the challenges that I face with the VI spit out from my experience is having no non-binary option. In that respect, there's like even in placing them to shelters, they're having to choose which side they go to, either the male or the female. That in itself is a traumatizing experience. So with that factored in the whole equation here, is there room for gender diverse population in the house?
That's a really good question. There isn't often because there's a kind of like a tyranny of data. As you know, we have too little in data on folks who are gender diverse. So where we often land with that is adding that as additional explicit criteria if that's something that the community wants to do. This is not a once and done. If folks feel like this tool is not picking up some of those challenges for some of our more vulnerable communities, then it's certainly something that can be added explicitly based on community preferences. And then as a data person, I'll come back and tell you what that means for validity and other things.
Thank you, I appreciate that. And thank you for all your hard work.
And Monique, if you have any words of wisdom before we move to action, you guys have spent, really valuable time doing a massive amount of research. You're asking the continuum of care to take some action and then look at models in terms of how things should be launched. If you feel there's something that you need to tell us about what might be the best way to go, whether it is a pilot versus totally rolling it out based on, I know you guys have looked at other counties and you spent a lot of time. So I don't know, I know you want to give the continuum of care the opportunity to weigh in, but you're the expert here. Is there a way that we can help you so that we know we need to do this right? So just throwing it out there.
Yeah, absolutely. So I am definitely a proponent of the phased and rolled out approach. And the reason why I say that is because smaller controlled groups are able to work out some of those major bugs, those major kinks that we may see. And then as we roll it out to other agencies and we see other kinks, we can fix it at those times. But to really have a tool we feel that is great for the masses, I think a smaller approach would be my first go-to, but I also want to respect the continuum and what everybody wants.
Thank you. Is the box the action we need to take so we can move to get you the feedback that you need to move to the next step?
Yeah, so we just need approval for us to share the data. So within that data sharing agreement, there's very specific data points that need to be shared that was not currently in our previous data sharing agreement. And so it's basically sharing the data from our VA SPIT app over to our contractor so that way they can validate the tool. And so just about to allow us to enact the data sharing agreement that's in place currently that we have both agreed to, behavioral health, HMIS, and our contracted providers.
Okay. Is there any other question or comment before we move to take action? Hearing none, do I have a motion to accept the data sharing agreement? So that, did I say it right? I want to make sure we got the.
Yes.
So do I have a motion to approve the recommended action?
Motion to approve. This is Chris, Path of Life.
Chris, thank you so much. Do I have a second?
Second, Claire from Family Promise.
Thank you, Claire. Do I have any abstentions or objections? Hearing none, can we give a big clap to Monique and the whole team for the extremely hard work? We are super excited as a region to support you in the next step so that we can do even greater job supporting our clients across the system.
Thank you all so much. I'm really, really excited to get some emotion going here. So thank you all for all of your support.
Okay, are we ready to go to the next agenda item? Let's go ahead and move on. Next slide. Okay, Ms. Clarice, do we have a quorum?
Yes, we do.
I guess I should have asked that from the last one. I think the heat is getting to
But
me,
we
you
do
guys.
for that one too.
I'm sorry. Okay. The next agenda item is to approve the June 17th minutes for the Continuum of Care. Do I have a motion to approve? Come on, you guys. Don't be quiet. We need to
Motion to approve.
Thank you. Okay, we have Chris as a motion. Who has a second?
Second, James Brooks and Mercy House.
James, thank you. Any abstentions or objections? Hearing none, this item passes as well. Let's move to the next agenda item. Standing agenda items, okay? COC lead agency update, Ms. Rashana, you are back on deck.
Thank you, Madam Chair. Good afternoon again, and I promise I'll be short. I know we are running out of time, but I just want to some quick announcements. We do have our request for proposals for our HAP funding, which is Homeless Housing Assistance and Prevention Program. That is currently out. The deadline for that those proposals are July 24th. So I just want to remind everyone about that deadline. We also had our HUD Continuum of Care program competition that deadline was July 9th. We received about 26, 29, approximately 26 to 29 applications for that program competition. So thank you everyone who submitted their proposals. we're working on getting those evaluated and ranked and scored. The next proposals or request for proposals we have out is our COC builds request for proposal, and that is for developers building permanent housing with the target priority population with seniors. That deadline, I do want to announce, you may have seen it in your email, that deadline was extended until tomorrow. So if you are thinking about or you are planning on submitting an application, that deadline was extended till tomorrow. And then the next we have our Proposition 47, which is our street medicine team that we spoke about earlier in this meeting. We have our local advisory committee meeting next week, July 22nd at 3 p.m. So if you would like to be part of this meeting or would like to know a little bit about this program or receive updates or even have some feedback, please join us then, and we will have the flyer to that meeting in the Google Drive, and if Clarice can drop that meeting, that flyer in the chat. And then lastly, I just want to know that we really value our COC, our members' feedback. We recently met with one of our partners that provided some feedback from the experiences that they received or others received moving through our systems. And from that meeting, our office agreed to have continued conversations and trainings with surrounding issues like housing stability, how to help those individuals we move into housing stay housed. So we agreed that we will continue that conversation. I know that we have been having some housing stability training, so we agreed that we will continue that training. But another suggestion that came out of that meeting was we agreed that we will provide like a welcome home guide template. And this template will provide, it's designed to empower and provide newly housed participants with some sort of checklist of what to do in situations once they move into housing, such as who to pay, who do they need to reach out to pay their rent, if they're late, who to reach out to, what utility companies they need to reach out to. If there's a maintenance issue, who would they contact? So things of that nature, we are currently developing that template that we will share with the COC at our next COC meeting. So I just want to say more to come with that. I just want to let everyone know that we truly value the feedback from our community. So with that being said, also, sorry, I have one additional update. I know our team last month, we talked about the HUD Youth Homelessness System Improvement. That grant, that program through it's YHSI. Our team is still currently working on that application, and that submission deadline is August 10th. So please, we look forward to receiving that funding. Of course, it's a competitive process, but we do look forward to receiving that funding. So with that being said, I will hand it back over to you, Madam Chair, unless anyone have any questions.
We just want to say thanks. I don't know how you guys do it all. Keep up the good work. It's amazing.
Thank you.
Do you sleep? I don't know.
Sleep.
Okay. Next agenda item. Okay, CES lead update, functional zero, veteran homelessness. Lucy, Miss Lucy, you have the floor.
Good afternoon, everyone. For anyone that I haven't had the pleasure to meet yet, my name is Lucy Bustos, and I am the social service planner for the coordinated entry system under Riverside County's Riverside University Health Systems Behavioral Health as the lead CES agency, and I will be providing the lead update for last month's data. Next slide, please. So I'll be going, as mentioned, over some data trends and upcoming CES announcements. Next slide. So for the month of June, there were about 2,391 calls made to the Home Connect. Our Home Connect team provided services such as diversion and pre-screening to over 700 new callers who called in. Of those screened, there were 42 families, 45 callers that were 55 plus, 18 of the callers were transitional aged youth, meaning they were 18 to 24 years of age, and 18 that were, or sorry, excuse me, 7 that were veterans. Next slide. And for the month of June, there were 1,086 members on the queue, with 207 of those being new additions. The cities with the highest numbers on the queue did see an increase this last month. We have Riverside at 288, which is roughly a 20% increase from May's Riverside queue at 240. Indio's community queue saw a slight increase as well in numbers, going from 168 to 184. And finally, Palm Springs queue went from 100 to 111. CES did connect 60 households from the queue to opportunities. 14 of those 60 referrals were referred to the permanent supportive housing, otherwise known as PSH opportunities, and the remaining 46 were referred to rapid rehousing, otherwise, as you see here, RH opportunities. Of those connected to those opportunities, 16 were TAY, 14 aged 55 plus, 2 veterans, and 26 fleeing domestic violence. Next slide. So CES announced to the COC last month that a regional coordination meeting was in the works, and we are excited to announce that it will take place officially in August throughout Riverside County. As a reminder, the goal of this meeting is to strengthen regional collaboration, improve communication between partners, and create dedicated time for coordinated housing discussions closer to where services are being delivered. So rather than bringing everybody to one specific location, CS will rotate through each of the supervisorial districts to make participation for our partners more accessible. Next slide. So we did cut the flyer in two to make it more legible and visible for you all. So this will be distributed to you all and provide an overview of what CS regional meetings will look like beginning in August. So each meeting will focus on regional case conferencing, housing coordination. We will review the district's community queue, discuss documentation needs, and review pending Home Connect referrals. We will also share housing opportunities, collaborate on barriers that may be preventing households to get into housing, as well as local resources, and create space for networking and problem solving among providers. So as mentioned, they will be held weekly. Each week is designated for a specific district and are intended for agencies actively participating within the coordinated entry, particularly case managers, outreach teams, housing providers, and we are excited to extend the invitation to other homeless service providers such as law enforcement, parks, DPSS, libraries, school and college districts, and other homeless liaison staff. District-specific invitations with meeting locations and RSVP instructions will be sent separately the closer we get to these meetings. So just please keep an eye out for that. And if there are any questions whatsoever regarding this meeting, what to look forward to and whatnot, please feel free to contact me. And my contact info is on that screen. Next slide. So we are seeking presenters for our partnership meetings for the 2027 calendar. Fortunately, we've been able to fill up the calendar for this year. So these presentations do provide a great opportunity to share your agency's programs, services, referral processes, and resources with providers across Riverside County. And our partnership resource meeting each month is dedicated to a community partnership presentation. And on alternate meeting dates, we do host case conferencing sessions where case managers can bring challenging cases for discussion and receive feedback, resource recommendations, and problem-solving support from partners across the system. So if you're interested in presenting or simply participating, please reach out to me and we will get you, we want to ensure we get you on calendar. Next slide. As we wrap up, we'd love to hear from you. If you have recommendations, questions, or ideas for improving CES processes, communication, or coordination, please don't hesitate to reach out. We welcome feedback and are always looking for ways to make the system more effective for providers and the individuals that we are serving. We've included this feedback survey and encourage everyone to take a few minutes to share their thoughts. Your input helps guide future improvements and training opportunities. I will, we did create a QR code, but I will also incorporate that link into the chat for once this presentation is over. Other than that, excuse me, that's all I have. If you guys have any question, any training needs that is CES specific, please feel free to reach out to me. I'm more than happy to get you on calendar for any upcoming needs that you guys may have, whether it's individual or agency specific. Just feel free to reach out. But that's all I have. If you guys have any questions, please feel free to let me know. Thank you.
All right, thank you, Ms. Lucy. Let's go ahead and move to the next agenda item. I didn't see any hands raised. Okay, another amazing coordinated entry team member, June.
Good afternoon, everyone. This is June Zhang from CES, to provide administrative support to the wonderful CES team that you've heard speak today. I know the clock is ticking, so let's get started. My slides today will be on the month of June 2026, specifically the veteran and TAY subpopulation on the coordinated entry system Q. For the veterans, we had 35 members on the overall CES Q, 12 of which were document ready and ready to be referred to housing opportunities that pop up, with 5 members with active referrals to either rapid rehousing or permanent supportive housing. And TAY members will be on the next slide. We had 96 members on the TAY community queue, 38 which were added to the queue in the month of June. That is my mistake, in the month of June, and 3 that exited in the month of June. On the next slide, we'll have the Home Connect hotline. This hotline applies to all members seeking services, whether they're at risk, imminent at risk, or literally homeless in the County of Riverside, not just for the TAY population or veteran subpopulation. Definitely keep that number handy. Have it in your wallet, have it in your car, in your desk. This is going to be the main number to get connected to services within the County of Riverside. Thank you very much, Madam Chair.
All right. Okay, next agenda item, Craig. What is your pleasure, sir? Do you, you have important information? Do you
Yeah,
wanna...
there's a lot of information, but I can get this done in like 3 to 4 minutes, so I won't read everything. Just do the highlights, if that's okay.
Whatever, this is important and it's lovely to have you, so thank you.
Okay, thank you, appreciate that. So the first state update is probably most of you aware that the governor and the legislature agreed and passed an affordable housing bond that will be on the November ballot. That's an $11.25 billion investment. If you want to go to the next slide, which outlines a variety. So it's a really comprehensive bond package that really is going to fill the needs of helping us to build more affordable housing. Notable for especially Riverside County is the Joe Cerner Farm Worker Housing, which helps with farm worker housing in the eastern part of the county, and then the multifamily housing program too, which we utilize quite a bit. If you can go to the next slide, please. On the state budget, through a lot of advocacy, we were able to get the legislature to provide $900 million in round 7 of HAP funding. So that's a big win. It's an increase of $400 million over what was allocated. Yes, exactly. And it actually roughly will be about $1 billion. Counties and COC jurisdictions will roughly get about the same allocation, even though it's 100 million less, because there's not a bonus set aside that there was in the last round. So, and they've also streamlined some of the application process as well, which will be helpful. And then just in the budget, you can see other items that were included in the budget. Most of these are recurring programs, but still maintain significant investment. So that was good news as well. We can go to the next slide, which is the state budget. Again, this is just another breakdown of some of the, it was $100 million of one-time human services housing investments. So outside of HCD funding, this is also some other programs that we utilize within the county as well. So again, mostly level funding, except for on the CalWorks Housing Supports Program, which we utilize a lot in Riverside County. There was a reappropriation of $45 million in unspent funds. So that was good news as well. Next slide, please. On the state budget, We had Medi-Cal eligibility, sorry, it provides 197 million. This is basically to help with implementation of the HR1 requirements, primarily around renewals and work eligibility, and then CalFresh eligibility too, to again supplement some of the HR1 damage that happened to the CalFresh. Next slide, please. Federal update, probably some of the best news we've had in a long time. A huge bipartisan bill, the 21st Century Road to Housing Act, was passed again in overwhelming numbers by both houses, the House and the Senate. The president did not sign it. However, after 10 days of Congress being in session, it automatically goes into law. So that went into effect on July 12th. You can see the opportunities for housing section. Again, a lot of regulatory type changes in this that will help, again, with speeding up the process, getting rid of some of the bureaucracy around environmental reviews. If you go to the next slide, please, I just break down kind of the different sections about being able to build more. We're going to be able to actually utilize up to 20% of our CDBG funding for actual construction. It raises the cap again on bank and public welfare investments. There's also provisions that don't necessarily affect California too much, but will decrease mega corporations from buying up homes. We go to the next slide, please. And then again, just creating, this is a little bit more of the allocation and the ability to streamline. This is a lot of repetitive language again from the last slide, but again, really some regulatory changes that should help us make sure that we are building more housing. And next slide, I'm almost done here, so be patient. One of the biggest things too for Riverside County is for manufactured home is the elimination of the permanent chassis requirement or wheels on manufactured homes. That will significantly decrease the cost. We utilize a lot of manufactured housing, primarily in the East Valley, but also other portions of the county as well. And then you'll see the other aspects of increasing loan limits and reauthorizing reinvestment for our community enhancement grants. And I believe that's my last slide. Yes. Thank you, Madam Chair, for letting me squeeze all that in.
Oh, yeah, I just am so sorry you had to be rushed. This is so important. Looks like Julie Hirsch has a question about not seeing much funding dedicated to senior affordable housing. Might there be updates on this type of support? Question mark.
Yeah, there's not a huge funding mechanism to this. It really was more regulatory and not directly specific to. There still will be language that will need to be finalized through HUD and the other agencies that administer these programs. So we'll keep an eye on that.
I had a quick question. Is there, I know it's probably a stab in the dark, but on HAP, is the conversation about permanent funding gone?
No.
Okay. Because it's just continuing,
as you know,
like temporary.
Yeah, it's a yearly fight, but that conversation will go on. There's a statewide organization called Bring California Home that I participate and serve on their coordinating committee. But they work a lot in conjunction with CSAC, with the League of Cities, with the big city mayors, and will continue to advocate not only for round 8 of HAP, but even more significant dollars for ongoing funding.
Great. Good job as usual. Thank you for the important work that you do for our region, Greg.
You're welcome. Thank you.
Okay, if we don't have any more questions at all, basically, there was a letter of support for Coachella Valley Regional Response Project. There were no meetings in the committees, but if they were, the summary of those meetings would be in the Google Drive. And this particular month, there's no APRs to review, but if there were, you would have access to them in the Google Drive. Next slide. This is kind of what I talked about at the beginning of the meeting. So I just want to say good job to you guys because you gave us some great ideas for future meetings. If you have any other ideas at all, we hope that you will, let me know. You could get a hold of us, coc@rivco.org. These meetings are for you and the people that you serve. Do we have any other ideas for agenda items? We have noted all the great ideas that we talked about at the beginning of the meeting. Okay, next slide. Any announcements? This is your time to talk about any exciting announcements, good news stories, anything you want to share to uplift everybody. Yes, Margarita.
Hi, thank you, Madam Chair. Welcome everybody back, I should say. I just wanted to add to the Prop 47 quarterly meeting that is coming up. I wanted everyone to know that this quarterly meeting, for first and foremost, our LAC, which is our local advisory committee, most of them are here on this call. The important work that they do, listening to our progress, our challenges, and our feedback, and giving us direction is amazing, and we appreciate them. But we also want the public's information. We want your feedback. So we do want you to listen in on how we're progressing, the challenges that we face. Maybe you can offer some feedback. Please reach out to me. I saw that the flyer was dropped in the comments. So please reach out to me if you want to attend that meeting so you can find out more about what it is that we're doing with the Rivco project, street recovery for Prop 47. That's it.
That's awesome.
Thank you.
Thank you. Great. Heather?
Hi again. I just real quick want to let everyone know that Mission Hope, we are in Temecula and we are hiring right now for a full-time housing navigator. So if anybody in the COC knows somebody that's looking for a job in Southwest Riverside County, go ahead and let me know. Thanks.
Awesome. Monique?
All righty, and I'll probably do this announcement at the next meeting as well, but I just want to remind everybody that Recovery Happens is coming up very, very soon. So it's our resource fair in September at Fairmont Park. So be on the lookout for flyers and please, please, please attend and rejoice with us for that event.
Oh, neat. That's super cool. Okay, anybody else? Okay, those were awesome. Yay, I love to hear those great updates.
Karen, Karen, I had one announcement.
Yes.
This is Carol.
Hi, Carol. Yes.
Very quick, I wanted to let you know that Faith in Action in collaboration with Riverside University Health System Behavioral Health is holding our first ever SOS Day, and that's going to be August the 12th, and it will be a day of services for anybody in the area or anybody that walks into the venue. It's actually behind our office in the Banning Chamber, but we're going to have all kinds of services for folks of any kind, all the way from appointments, counseling appointments right there to food. So I'll send out the flyer to the COC and maybe you could distribute it, which would be great. August 12th. Thanks, guys.
We always love to do that. That's exciting. Thank you, Carol. Okay. Anybody else? If not, next slide. Okay, you guys, the 6 minutes extra, I hope you feel was worth it. It was an amazing meeting, a lot of important topics, and thank you to all those who worked so hard on the agenda items. I hope you all have a beautiful, beautiful rest of your day, and we look forward to seeing you next month. Take care, everybody.
Thank you.
Bye. Thank you.
Bye, everyone. Thank you.
Bye.